The first person I'd like to invite to the mic would be Alex Garcia with Blue Shield of California.
Thank you, Katrelia.
Hi
Really
there.
appreciate it. So again, welcome everyone. Really happy to be here and present the Blue Shield of California benefits designs through CalPERS. What I like to do is be as brief as possible and be able to give you the highlights of what's different for the 2022 year. So you're going to notice that you've got multiple options through the Blue Shield plan. The very first one that you will see is Access Plus. This is our broad network plan. And we do have some changes, actually enhancements going into 2022. This may not be applicable to most of you since most of us are here in Southern California. But if you have any dependents that you cover in Northern California, please be aware that we are re-entering 8 counties. Alameda, Contra Costa, Marin, San Francisco, San Mateo, Santa Clara, Sonoma, and Solano. So it's just a good knowledge to have that if you're interested in joining Access Plus HMO, those are new areas that you can enroll in. The other option won't apply too much for most of us. It's an EPO plan, and this is really meant for members or agencies who reside in areas that are in rural counties or, out of the area locations. So when you look at the Blue Shield options, just pay attention mostly to Access Plus HMO and Trio HMO. Now, Trio is our low-cost option as you start to look at your payroll deductions. Now you'll see that you're getting coordinated care and similar benefits as that of the Access Plus HMO plan. We are expanding our coverage to Orange County in Southern California. Now, what makes it different, and I know there's going to be questions about it, between Trio and Access is really the network. So you'll see that in a few moments as I'll go over. Now, the last option here that you have, again, not for everybody, but it is for those that are considering retirement. Once you become Medicare eligible and qualify for Parts A and B of Medicare, we do have a Medicare option that will be introduced on January 1st. If you'd like more information, please visit us on our website. That website, I'm going to back up a little bit, is blueshieldca.com/CalPERS. So again, I just wanted to highlight the differences between the two plans. First is really just the network. So you'll see here over to the left side of your screen, Trio isn't available everywhere, but is available in these counties. Access Plus, again, is a broad network plan, so you'll be able to access care throughout California. Both plans offer no deductibles, no coinsurances, no claim forms. There are fixed copays, so that helps you manage your budget. Hospitalization is covered at 100%, and you do have the virtual care option, as well as an extensive network of pharmacies, as you'll see there on the screen. So just want to call out even further what the plan designs are. You still, on both plans, have the emergency service. It's a $50 copay. So if there is an emergency situation, know that when you go into the emergency room, you'll pay a $50 copay. Everything else would be covered. And you have additional services available to you, again, on both plans, chiropractic and acupuncture care. This is a self-referral service through the American Specialty Health Network. So you do not need to have a request for permission from your primary care doctor or your medical group. You can simply call a American Specialty Health Plan chiropractor or acupuncturist, make an appointment, and show up. Your copay is $15. And if you're looking for virtual care, note there that you have the service for medical and mental health. So if you'd like to save yourself a trip, save yourself a copay, you can certainly make a visit to a doctor, a live doctor that's able to prescribe drug medication. So keep that in mind. And so here are the benefits side by side. So again, you'll see very similar benefits going between Trio HMO and Access Plus HMO. You'll see no deductibles on both. You see $15 copayments to see your physician on both. And you notice there that your benefit for hospitalization is covered at 100%. So it's great to know that whether you pick Trio or Access Plus HMO, you're going to have the right coverage. In terms of health and wellness programs, we do have a wellness coordinator. So we have Wellvolution. This is a program that's there to prevent and reverse disease, and it's able to provide you with different digital programs to help you improve your health, whether it's eating better, exercising more, reducing stress, sleeping better, or stop smoking. There is an app and there is incentive plans to help you be able to achieve the goals you're out to meet. And in addition to that, we have the condition management program and prenatal programs available. Now, I'm going to touch on this because this is actually something that is frequently asked, and this is about emergency services. Emergencies are covered worldwide. As I talked about earlier, your copay is $50 to enter the emergency room. Now, I just want to highlight too that when you get admitted into the hospital, that $50 copay is waived, so you will have 100% coverage for that emergency. But also know too that while you're traveling, whether you're out of the area, maybe a few miles away, or maybe the other side of the state, or in a different state, or out of the country, you're going to be covered for emergency services worldwide. So take note at the numbers at the bottom. You'll see that 93% of US physicians are within the Blue Shield network, and 96% of US hospitals are also in our network, in addition to 230 countries that we have physicians located in. So wherever you are, we're sure that you're going to find the coverage that you need for an emergency. And if you'd like to have more information, certainly you're going to have a lot to take in today and throughout open enrollment. If you have any questions and you'd like to read for yourself what Blue Shield has available, visit our website. It's blueshieldca.com/CalPERS. You'll be able to find doctors, hospitals, specialists within our site. You'll be able to download information, and you'll be able to view video presentations just like the one we're conducting now at the comfort of your own home. Now, an additional service too, just want to call out, if for any reason there is a question, just because of sake of time, just don't or just didn't think of the question. When you visit our website, there is an option for you to book a consultation service, a one-on-one meeting, whether you'd like to have it via phone call or a video Zoom call like today. You and I can sit down, have a conversation, and discuss your benefit questions. So just wanted to call that out. And with that, Katrelia, I am ending my presentation. Thank you, everyone.
With that, we're going to move next to HealthNet with Tammy Madsen. And if you would hold on, Tammy, you can introduce yourself while I get your video up and running.
Sure. Thank you, Katrelia. I just wanted to welcome you to Open Enrollment and let you know that I am here to answer your questions should you have any. And Katrelia will start the video.
Welcome to HealthNet for CalPERS 2022 Open Enrollment. We invite you to explore your 2022 HealthNet choices. Whether you're new to HealthNet or coming back to us for 2022, we're here to provide useful information about HealthNet Open Enrollment. Earn rewards for improving your health. Choose the right HealthNet plan for you and your family. Use our custom website and social media tools to help manage your health. Find local doctors in the SmartCare HMO and Salud HMO EMAS networks. Access wellness and specialty programs exclusively for CalPERS members. Why choose HealthNet? During this year's open enrollment, please consider this. In creating our plan choices for CalPERS for 2022, we began with our greatest strength, delivering affordable HMO plans throughout California. We work to make a positive difference in the lives of the people we serve. For over 40 years, HealthNet has supported Californians throughout various stages of life, and that's what we continue to do. We believe you deserve reliable health coverage from a local company that understands your needs. You have two HealthNet plan options to choose from. First, you have SmartCare HMO, which gives you access to an established local provider network that connects you to respected, high-quality doctors, provider groups, and hospitals. Second, you have Salud HMO IMAS, a community-centered, Latino-focused, and budget-friendly plan. Includes cross-border physician access to SIMSA in Mexico. This map identifies the networks by county so you can see at a glance which network is available to you. Summary of benefits for each plan. Here we see a side-by-side comparison, and we also see that there are some benefits that are covered at no cost to you, such as preventive care office visits, including well woman exams, vision exam for refractive eye exam, x-ray, laboratory procedures, prenatal and postnatal office visits, and hospitalization. We also see a $15 copayment for doctor, specialist, minute clinic visits, urgent care, and chiropractic and acupuncture. Chiropractic and acupuncture have a combined maximum of 20 visits per calendar year, and services are administered by American Specialty Health Plans, Inc. For emergency care, the copayment is $50. A bridge to healthy actions. The Decision Power Health and Wellness Program gives you personalized tools along with the support and confidence to take action for positive, lasting health changes. Highlights include Health Coaching Program, Tobacco Cessation, and Health Assessment. More ways to access care. Wellvy helps you decide on, prepare for, and recover from surgery. Complete the first 3 modules of the program in a brief survey and you'll receive a $25 gift card. Nurse Advice Line. Our toll-free 24/7 nurse line gives you immediate access to clinical support for everyday health issues and questions. Omada. Through Omada, you'll gain access to all you need to lose weight and reduce your odds of developing type 2 diabetes and heart disease. HealthNet Mobile. Connect your HealthNet.com account on the go. And Minute Clinic, convenient walk-in medical service in select locations, generally located inside CVS pharmacy stores. When you take action to improve your health, we love it. That's why we reward you for taking preventive steps to make healthy choices and changes to your lifestyle. Choose one program option. Complete the Tobacco Cessation Program telephonic, or complete the Health Coaching Program as well as an evaluation call. You can enroll in both programs. Only $100 gift card is available per calendar year. Take the health assessment and review the report with your doctor. Then complete the PCP form online. It really is just that easy. One $50 gift card is awarded in a calendar year. If you're trying to decide on surgery, you can register and log into healthnet.com/CalPERS. Then go to the Wellvy website. Get help and support while making your surgical decision. Complete the first 3 modules of the Wellvy Surgery Decision Support Program in a brief survey, and Wellvy will send you a $25 gift card. As a registered member of the website, you'll have 24/7 access to the user-friendly tools and health information you need most. Here's just a sample of all you can do. Get your benefit details and copayments, evidence of coverage, or summary of benefits and coverage. Find a doctor, get ID cards and forms, manage your account details, and view medical treatment policies. Get valuable discounts on health-related services and products. Plus, use our provider comparison tools and treatment cost estimator. Decision Power. Fill out a health assessment, participate in online health programs, track your health, and access online services 24 hours a day. Nurse Advice Line. Here's what you need to know. It's available 24 hours a day, 7 days a week. Licensed registered nurses, immediate triage, timely intervention, telephonic access, provides triage support based on industry-approved clinical guidelines and protocols. Benefits. Prevent unnecessary office or ER visits, self-care advice for minor injuries and illnesses, empower participants, ability to immediately address clinical questions, and direct member to appropriate level of care. If you have any questions, we're here to help. Please contact our dedicated customer contact center for CalPERS at 1-888-926-4921 or the dedicated website healthnet.com/CalPERS.
Okay, let me stop sharing.
Thank you, Cottrell. And I want to let you know that I will be available afterwards should you have any questions.
Way over here.
Perfect.
All right. So once again, thank you, Cottrell and Karita, for letting me go ahead and present for United Healthcare. My name is Sandy. I'm delighted to share and help everyone understand United Healthcare's basic HMO plan options available to you. Like Cottrell said, sorry, I was going to say Karita. If you have any questions, please be sure to kind of hold off until after the presentations are done, and then we can all jump in and help you in the breakout rooms. And also for specific personal questions, we do ask that you please call our dedicated customer service number, which will be provided at the end of the presentation. Knowing your benefits can help you make more informed healthcare decisions. I know a lot of people are concerned about what's going on, if anything changed, and what plans to choose. So it's good that you all are here to listen and get a better idea as to what type of benefits are being offered to you. In today's presentation, I will give you an overview on United Healthcare's HMO plan options offered to you, which are the Signature Value Alliance and the Signature Value Harmony, which is new for 2022. I'll go over the differences between both health plans, coverage and copays, including Chiro and Acupuncture. And I'll show you United Healthcare's online resources and digital tools that can help manage your health and well-being. And also how to get in touch with an advocate, which is part of your dedicated customer care team. So let's get started there. As you can see right here, these are the United Healthcare Basic HMO Plan options. We have the Signature Value Alliance, which is available in 26 counties throughout California. And you can see the different medical groups that are contracted with United Healthcare on the Alliance plan. For the Signature Value Harmony HMO plan, that is new for 2022. This plan is available in 5 counties in California, Southern California, which are LA, Orange, Riverside, San Bernardino, and San Diego counties. To confirm which United Healthcare HMO plans are available in your home and or work zip code, you can use the health plan search by zip tool at calpers.ca.gov. The Alliance and Harmony HMO plans require you to select a primary care physician who can help you manage your care. Each enrolled person on your plan will need to choose a primary care physician. And if you do need to see a specialist, a referral is required from your primary care physician as well. For OBGYN, chiropractors, and acupuncturists, referrals are not needed if they are in the network. And it is important to know that there's no out-of-network coverage. If you use an out-of-network provider, you will be responsible for the entire cost of service. The exception to that is emergency and urgent care, which is covered wherever you are. As you can see, the co-pays for both plans are exactly the same. They haven't changed, and it's for the primary care physician, it's $15, and also that's for the specialist. There is a $50 emergency copay, which it will be waived if you're admitted to the hospital. Your urgent care and virtual visit copays are $15 per visit, and your copays for lab and x-rays are at no charge. And just like with the other plans, Chiro and Acupuncture is also included. You will receive 20 combined visits per calendar year at a $15 office visit copay. Optimrx is your United Healthcare plan's pharmacy care service manager. With Optimrx, it's easy to save on medication. If you choose to receive your prescriptions by mail, you can get up to a 3-month supply for 2 copays, and you will save a trip to the pharmacy. If you have questions about your pharmacy benefits, you can contact Optimrx at 855-505-8110. And also, I know Christina with Optimrx is going to be presenting, so if you have any other questions, she's there for you. She'll be there today for you. Easy ways to find a network provider. If you have a primary care provider, check to make sure they're in our Alliance or Harmony HMO network before you see them. There are a couple of ways you can search our network. You can use the search for a provider button on uhc.com/CalPERS, or you can call the UHC customer service team at 877-359-3714. Support and wellness resources are available to you and your dependents. The United Healthcare HMO plan offers a wide variety of programs and services such as behavioral health solutions, virtual visits, Real Appeal, Simply Engage, and so much more to help you live a healthier life. Behavioral health does provide a full coverage for all behavioral health needs, anytime, anywhere, and gives you confidential help with a variety of concerns. And we also offer the virtual visits where you can get access to care 24/7 and connect with doctors from your mobile device, tablet, or computer. With the virtual visits, our providers are Teladoc, Amwell, and Doctor on Demand. Real Appeal is an online weight loss program designed to help you lose weight and keep it off. Connect online and get motivational support, coaching, and tools tailored to fit your lifestyle and schedule. And we also have Simply Engaged. It is an innovative wellness program that rewards you in gift cards for completing healthy activities and actions. If you like, I can give you more details on these wellness benefits during the breakout sessions too. Help is just a call away. Our customer care team is available by phone to help support and answer any questions you may have. Whether you're a United Healthcare member or not, and you have specific questions or just seeking information about our benefits, our customer care team will be happy to help you. And they're available from 7 a.m. to 8 p.m. Monday through Sunday at 877-359-3714. You can also find more information about your benefits when you visit our website at uhc.com/CalPERS. Well, this about ends my presentation. I do hope this information was helpful. Thanks for taking the time to hear about your United Healthcare benefit options. Thank you.
Again, I'm Sunny Smith from Kaiser Permanente. I'm a territory manager, and I'm joined by my colleague, Carmen Conover. And if you have any questions that come up during the presentation, Carmen will be happy to address those. We're also going to be available after the meeting in the chat, and we will be on after all of the segments conclude, just to make sure everyone's questions are answered. So thank you so much for having us. Okay, so I want to talk a little bit about Kaiser Permanente and how we're different from other health plans. At Kaiser Permanente, our care is connected. We are both your provider and your health plan, which makes your life easier. Your doctors, the hospital, and the health plan work together, making it more convenient for you to get the right care when you need it. Your personal doctor, specialists, and nurses are connected to each other and you. Through our electronic medical record system, you get personalized care. Our doctors can see your health history, like your conditions, any medications you're taking, and any allergies you have. Getting care feels faster and easier with Kaiser. We also want you to note that referrals aren't needed for certain specialties like obstetrics, gynecology, mental health, and any drug dependency services. So we also have several ways to access care. You can have a video visit, a phone appointment, and those are currently at no cost to you as a member. We also have resumed several in-person visits at our facility. You can see your doctor, you can get your lab results, pick up your prescription, all without leaving the building. So you can save more time and get more things accomplished during one visit. Also, we're going to talk a little bit about our telehealth services. As I mentioned before, we offer improved access to mental health services, and we have 4 telehealth channels available for our member population. You have the ability to access your 24-hour advice nurse for any non-urgent medical related questions that you have. You have the ability to set up a video or phone appointment. You can also email your doctor any non-urgent questions, and you can set up an e-visit also at no cost to our members. We also have the ability, you would also have the ability, to access care through your KP mobile app or on kp.org. And as I said, in several instances, there's no copayment for those services. Okay, so let's talk about what happens when you are traveling outside of a Kaiser Permanente service area. Since keeping you healthy is our first priority, you are covered for emergency services as well as urgently needed care anywhere in the world. You can also get urgent care at minute clinics in select CVS and Target stores. We also have our partnership with Concentra urgent care centers when you're traveling outside of the Kaiser Permanente service area. We have national contracts established with 878 minute clinics and 523 Concentra urgent care clinics in 33 states, including Texas, Florida, New York, Pennsylvania, and Illinois. To find out more about the travel-related services, we encourage you to call our travel line, or you can visit our website at kp.org/travel. Your mind and your body are connected. What you feel, think, and affects your total health. At Kaiser Permanente, we're committed to caring for the whole you, and we want you to achieve your optimal health in mind, body, and spirit. Kaiser Permanente provides clinical and support services for a wide variety of conditions, including anxiety, stress, depression, drug dependency, and autism spectrum disorders. Our mental health team also includes psychiatrists and psychologists, as well as marriage and family therapists, addiction medicine physicians, and medical social workers. And as a member, you don't need a referral for mental health care within Kaiser Permanente. Good health goes beyond a doctor's office, and here are some wellness resources available to help you thrive. We have our self-care apps, Calm and My Strength. We also offer wellness coaching by phone, and we have a number of online tools, which I will discuss in the coming slides. We also have reduced rates for members. Our members get the opportunity to have special rates on a variety of products and services through our Choose Healthy program. Some of those services include massage therapy, home gym equipment, and wearable devices like Fitbit or Garmin, for example. We also have discounts on health classes where you can choose from a large variety of classes and support groups offered at our facilities. And many of those classes are now offered online to our members. And finally, our seasonal farmers market. You can enjoy fresh local produce, specialty food items, and more, hosted at several Kaiser Permanente facilities. So let's talk a little bit about the membership perks to help you stay physically and mentally fit. We'll start with ClassPass. ClassPass helps you get moving, and it has the ability to have you participate in a variety of online classes that you can choose on demand. There are fitness classes online that include cardio, strength training, and yoga. There's also reduced live stream and in-person fitness classes like Pilates, dance, boxing from top fitness studios. And those are offered to our members. The downloadable on-demand videos are at no cost to the Kaiser Permanente member population. So we would encourage you to go to kp.org/exercise to learn more. And my absolute favorite perk in the wellness world is the Calm app. Calm uses meditation and mindfulness to reduce stress and anxiety and help you improve sleep. It's no cost to Kaiser Permanente members. The app offers something for everyone. It has daily check-ins for you to help assess and record how you're feeling and what you're grateful for, and to view daily reflections. There's over 100 guided meditations for a variety of topics, such as calming anxiety and stress, easing depression, practicing gratitude, fostering focus, and more. There's also soothing bedtime tales for adults that help you fall asleep faster and fosters better sleep quality. Calm masterclasses are also available, and they're taught by world-renowned experts and celebrities. And you can find out more about the Calm app by going to kp.org/self-care apps. So now that you're familiar with the Kaiser Permanente integrated care system and some of our resources to help keep you healthy, let's talk about the benefits. So you are currently offered the commercial basic plan. Under this plan, you have a $15 copayment for physician services. So that would include all of your doctor's care. So if you have an appointment with your primary care physician, your urgent care specialist, your specialist or an urgent care physician, those will all be a $15 copayment. If you ever need to be hospitalized, there is no charge for that occurrence. Also, on the plan, you have prescription drugs. There's $5 co-payments for generic and $20 for brand. We want to also have you keep in mind that this is for a 30-day supply. We do, however, offer mail order incentive where you can obtain a 100-day supply for the price of 2 months versus 3. We also have our 24-hour advice nurse, wellness coaching by phone. That's available to our members at no charge. Your lab work is also covered at no charge. And we do offer chiropractic acupuncture, where you get $15 co-payments assessed for up to 20 visits. And we contract with a company called American Specialty Health. And we can give you the website where you can locate those providers. That's the one service that is handled outside of the Kaiser Permanente network. So I would like to thank you for your time and invite you to come see us in the breakout session.
Okay, before we get to Anthem Blue Cross, because I know many of you are waiting for the information on the changes, I want to let us hear from Christina Fountain with Optimrx regarding our prescription plan, for those of us who may have Anthem or some of the other plans. So with that, Christina, would you share your screen now?
Are you able to see this?
Yes.
Benefits administered by Optimrx. Optimrx is a full-service pharmacy benefit provider with a broad network of retail pharmacies, a mail service pharmacy, and specialty pharmacy and infusion services. This presentation is intended for active employees and retirees who are not Medicare eligible. Optimrx manages the prescription benefits for the following health plans: Anthem Blue Cross PPO and HMO, HealthNet, Sharp, United Healthcare, and Western Health Advantage. Optimrx does not manage the prescription benefits for Blue Shield or Kaiser health plans. Your health plans manage your medical benefits, and Optimrx manages your prescription benefits under one premium. Please note, not all health plans are available in all coverage areas. Optimrx offers the Preferred 90 program for basic plan members. This program allows you to receive up to a 90-day supply of your maintenance medications at 2 times the copay. That means you may get the benefit of a 3-month supply for the price of 2. You may fill your maintenance medications for 30 days for 2 fills at any in-network pharmacy. However, you may pay a higher copay on your 3rd fill if you are not filling a 90-day supply on your maintenance medication. A maintenance medication is any prescription taken on a regular or long-term basis to treat a chronic condition such as high blood pressure, diabetes, or heart disease. To take advantage of these savings for your maintenance medications, you can fill your maintenance medication at a preferred pharmacy or have it delivered to your home from Optima Rx Home Delivery Pharmacy. Non-maintenance medications or short-term prescriptions, such as an antibiotic, can be filled at any in-network pharmacy. Major chains like Rite Aid, CVS, and Walmart are all part of Optima Rx's in-network pharmacy providers. The Preferred 90 program consists of Optima Rx Home Delivery, Walgreens retail pharmacies, Duane Reade retail pharmacies, and select pharmacies in areas where a Walgreens is not available. A list of those pharmacies can be found under the Resources section of the optimrx.com/CalPERS website. You can also call our Customer Care Center to find out which pharmacies in your area are preferred pharmacies. If you are interested in Optima Rx Home Delivery and the convenience of your medications delivered directly to your home, simply ask your provider to send an electronic prescription for 90 days to Optima Rx Home Delivery. You may also call our customer care representative to initiate a request for a new prescription for you. Our customer care team is available 24/7 to answer your questions about home delivery or your prescription benefits. If you have questions or concerns about a specific medication, our pharmacists are also available to assist you. It is important to know how much your prescriptions will cost. Covered medications will fall into 3 copay tiers. Generic medications are covered under Tier 1. Preferred brand medications are covered under Tier 2. Non-preferred brand medications are covered under Tier 3. As mentioned earlier, filling your maintenance medications at a preferred pharmacy for a 90-day supply will provide additional savings. You may also fill a 90-day supply at any pharmacy that's contracted with Optima Rx to fill for 90 days, but you will not get the copay savings. Let's look at an example on how you can save money on your copay for a maintenance medication. John Johnson uses an inhaler, which is a maintenance medication. If he picks up a 30-day supply of this medication, his copay for the first 2 months is $20 each, totaling $40. If John fills a 90-day supply through a Walgreens or Optima Rx Home Delivery, his copay will be $40. In this example, John would save $20 every 90 days, or $80 a year in copays. If Mr. Johnson continues to pick up a 30-day supply of his ProAir, he could end up paying the same copay as he would for a 90-day supply. Remember, your plan only allows for 2 30-day fills of maintenance medication at the 30-day copay. Non-maintenance medications are not subject to this rule. For a price quote of your medication, please contact our customer care team or visit our website, optimrx.com/CalPERS. OptimRx has a customized website dedicated to CalPERS members and will be a valuable resource for you. Site features include plan benefit information, locate a network pharmacy, price your medication, check if your drug is covered on the formulary and if prior authorization is required. To get the most accurate drug pricing, register and log into your account, where you will also be able to view personalized prescription information and additional features including managing your mail service prescriptions, order refills, delivery status, and automatic refills. To locate an in-network pharmacy, use the Find a Network Pharmacy search tool. Enter your pharmacy by name or location, using a zip code, city and state, or address. You can select filters to conduct an advanced search for a more specific request, such as delivery, or open 24 hours. A network pharmacy is not the same as a preferred 90 pharmacy. All preferred 90 pharmacies are network pharmacies, but not all network pharmacies are a preferred 90 pharmacy. Once you enter your search, the tool will bring up a list of all in-network pharmacies in the range you selected. To see if the pharmacy is contracted to fill maintenance medications for 90 days, Click on View Details, and under Services it will say Retail 90 days. You can also get an estimate of your medication cost by using the drug pricing tool. First, select the plan that you are enrolled in or thinking of enrolling in. Then, select the pharmacy location that you are interested in pricing this medication. Next, type in the name of the medication you would like to check the price on. At this point, you can look at the drug information as well as lower cost options. To get more accurate pricing, you can also edit the dosage, quantity, and day supply of the medication. Once you submit this information, it will give you costs for the various pharmacies in the area, as well as Optimrx home delivery costs. If your medication requires a prior authorization, it may not pull up an accurate price. You can always look up the formulary to see what tier the medication will be on if the prior authorization is approved. If you still have questions, please feel free to speak to our customer care representative for assistance. What is a prior authorization? Similar to the medical health plan, your doctor may need to obtain approval from the insurance prior to requesting any tests that he or she may want to run. Similar rules apply to your prescription plan. Certain medications may require prior approval before it is covered by the plan. Optimrx will work with your doctor to ensure safe and effective use of prescribed medication. Certain medications may have different types of coverage requirements. Prior authorization ensures the medication prescribed to you meets FDA guidelines for safety and effectiveness for your condition. Step therapy is an approach to medication therapy that requires you to first try a more cost-effective medication, usually a generic medication, that has proven effective for most people with your condition before you can receive coverage for a similar, more expensive brand-name medication. Quantity limits confirms the prescribed quantities are consistent with clinical dosing guidelines. This program was established to provide safe and appropriate use of certain medications. If you are prescribed a medication exceeding a set quantity limit, your doctor may need to work with Optimrx for approval. To check if your medication is subject to any coverage requirements, you can pull up the formulary documents and look at the Coverage Requirements and Limits column for coverage details. The Optimrx app is a convenient way to manage your prescriptions on the go. Download the Optimrx app from either Google Play or the Apple App Store. After you download and open the app, simply log in with your Optim ID and password. If you are a first-time user, you will need to register as a new Optimrx participant. After creating an account, you will be able to log into your personalized page. You will be able to view your prescription history, find drug prices and lower cost options, locate a network pharmacy, refill or renew a mail service medication, transfer a retail prescription to Optimrx home delivery, check the delivery status of your home delivery prescriptions, and more. Thank you for taking the time today to learn more about CalPERS Optimrx prescription benefits. If you have any questions regarding Optimrx or your pharmacy benefits, please visit optimrx.com/CalPERS or call an Optimrx customer care representative toll-free at 855-505-8110, TTY 711, 24 hours a day, 7 days a week.
All right, Christina, thank you for that information. I will have to call customer care. Okay.
Okay, Cornelia. They're open
Thank-
24/7. If anybody
wow.
has any questions, I will be in the breakout room if you have any questions on your prescription benefits. And thank you, Cornelia, for inviting me again.
Yes, absolutely. Thank you. I learn every time you come. So glad to see you here again with us this year. Okay. I've been missing out on some of my perks under the benefit. Okay. So I got to get moving on this. With that, we are now going to move to the last presentation. The health benefits unit will not be presenting today, but they do have a breakout room, and Karita Hughes is here to make sure that any questions you might have, she will be available to answer them. We have our account representative, Wendy Franco, here to present. So I'm going to give the mic to her. Wendy?
All right, well then let's go ahead and get started. So thank you so much. For those of you who have not met me before, my name is Wendy Franco. I'm a Senior Account Manager over Operations. I've been with Anthem a little over 22 years, so I'm very, very familiar with the PPO plans and the HMO plans that we offer for CalPERS members. So we're going to go ahead and take a look at that. I know you guys have been patiently listening to all the exciting healthcare information on a Friday afternoon. So without further ado, I'm going to go ahead and get started. Here we go. And another thing, don't forget your open enrollment ends October 15th. So make sure you get that information in on time. So what's new for 2022? We have simplified our PPO offerings and changed the PPO plan names. Of course, the quality that you can expect from these plans have not changed. PERS Platinum and PERS Gold are the two plans that will be available to you in 2022. Now, PERS Platinum is formerly PERS Care, but it's also going to include PERS Choice members who do not make a decision during open enrollment, which I'll touch on that in just a moment. It's going to offer the same Anthem Blue Cross Prudent Buyer PPO network. PERS Gold, as you know it today as PERS Select, PERS Gold is going to be the exact same Anthem Blue Cross Select PPO network and the same value-based benefit design as the original PERS Select plan. So if you are currently in PERS Select, nothing is changing for you come January 1, 2022, except the name. For those of you who are currently in PERS Care PPO, nothing is going to be different for you except the name. If you are a PERS Choice member, again, it is being discontinued effective January 1. So members who are currently enrolled in the PERS Choice PPO plan and you do not make a change during open enrollment, you will automatically be moved to PERS Platinum. Okay, so PERS Choice and PERS Care members who do not make any changes will be automatically moved to PERS Platinum, and PERS Select PPO members will automatically be moved into PERS Gold if you do not make a change. Again, our two PPO plan options are designed to give you the freedom to find the care that is right for you. PERS Platinum is a nationwide plan, and it does offer access to our full PPO network and the highest level of coverage, which we will take a look at on the next slide. PERS Gold is available exclusively for California residents. It offers access to a subset of our full PPO network, so it's that select network that I mentioned, and it is a value-based plan which rewards you for making healthy choices. Now, I know that it says PERS Platinum is nationwide and PERS Gold is available exclusively for California residents. However, keep in mind that both plans offer your full benefits nationwide. Okay, so that is just speaking to where if you move out of state, you need to enroll in that PERS Platinum plan if you want a PPO because it's the only one that's nationwide. If you are going to reside in California, if you are an active employee or retired, if you're staying in California, you're going to have Platinum and Gold available to you. But if you move outside of the state of California, you're going to only have that one option of PERS Platinum. You can access the full PPO provider network outside of California on both plans through our Blue Card PPO program. So here we're going to look at that side-by-side comparison. So PERS Platinum, again, is that highest level of coverage and offers our full PPO network. And PERS Gold is the least costly premium of the two, and it is our select PPO network. PERS Platinum is a 90-10 plan. PERS Gold is an 80-20 plan. I'm just going to highlight the differences here because otherwise everything's going to be the same, as you may have already noticed. The deductible on PERS Platinum is $500, just like it is today on PERS Care and PERS Choice. PERS Gold is a $1,000 deductible. However, we give 5 $100 credits on the PERS Gold plan, or the incentives for credits. And we're going to look at that on the next slide to bring that deductible down to $500. The office visit copay works a little bit differently. So with the PERS Platinum, general or family practice doctors are $20 for an office visit copay, and all specialists are $35. PERS Gold is a $35 copay across the board. So that's whether it's your general or family practice physicians, specialists, it's $35 across the board. However, we do ask that you designate a primary care physician or a personal care doctor, and that's not to make you have to get referrals. You don't have to worry about if they're accepting new patients. It's not like an HMO where you have to check those things or go to them to direct your care. This is really for us to know, hey, I've designated, this is the doctor that I see most often, or this is the one that I really have as my go-to if something's up, everything's good, I just want to have things checked out. You're going to let us know who that is. So when you go to them, we are going to have it at a $10 copay for you. So again, we really want to, encourage you to designate that primary care physician. Again, not to get referrals or anything like that. You don't have to worry about that. That's merely just to kind of build that relationship with that doctor that's going to work with you to help guide that care for you. For chiropractic and acupuncture, both plans offer 20 visits per calendar year at a $15 office visit copay for in-network providers. Emergency room copay for that facility claim is still $50. The routine preventive coverage on both plans is remaining at a 100%, no deductible, no copay, no coinsurance when you are seeing an in-network provider. And of course, the pharmacy benefits are still included, and they're still going to be administered by Optimrx. So very quickly here, I want to take a look at the PPO plans and how they work differently from an HMO, right? With a PPO is going to have a deductible, and it's going to have a cost share involved, okay, other than services that you see might be at 100%. So say you go to the doctor's office, it's the first time you've gone, for the year, you're not feeling good. The doctor says, I want to do some tests, I want to do some lab work, things like that. You're going to go, you're going to have your office visit copay, and then he's going to say, do a throat swab, or maybe do some x-rays and send those off to the lab or the diagnostic center. Those are the things, anywhere where you see the 80-20 or a 90-10 or even a 60-40 for out-of-network providers, meaning we pay after the deductible. Your responsibility is that first, say, $500 of covered charges. Once you've satisfied that first $500, on PERS Platinum, we pay 90% of the contracted rate. You'd be responsible for 10%. This 10% is going to go into a bucket, okay? And that bucket's going to be called your maximum coinsurance out of pocket. So should you have extensive claims and things like that coming in, your 10% should not exceed that $2,000 maximum coinsurance out of pocket, okay? Should you have claims that are still coming in, bills that are still coming in, once you've satisfied your deductible of $500 and you've reached that $2,000 maximum coinsurance out of pocket, this is your safety net here. We're going to then pay it 100% for the rest of the year for in-network services and covered medical benefits, of course. And that's going to be across the board for you. So it's not per injury, per incident, per situation, what have you. It's really going to be all your medical benefits all together. So you have that kind of backup safety net for you. And likewise on PERS Gold, just like you may be familiar with it today on PERS Choice or PERS Select, it's the 80-20 plan with a $3,000 maximum coinsurance out of pocket. So now let's take a look at that deductible, okay? As I mentioned, we offer you 5 ways to earn $100 to bring this down to $500, All right. So not only would you be saving in your monthly, potentially your monthly cost for the plan itself, but you're also going to have a lower deductible than what you see here. That's really the equivalent of what PERS Platinum offers. Okay. So a lot of you might be thinking, hey, you know what? I know how this goes. You say there's all these credits, there's all this stuff that we can get, but we have to jump through flaming hoops and cartwheel and somersault out of it. And that's not true. So we make this as easy as we possibly can for you guys. So that said, let's take a look at what these three are, or I'm sorry, what these five are. And I'll mention the three versus the last two. So if you have a flu shot at a pharmacy in your plan's network, at your doctor's office, you can even go out of network, or say your employer is offering a wellness fair and they're doing flu shots there. You just call us and let us know, or you can log it into your Sydney Health mobile app, with which we will look at it in a later slide. Let us know that you got it, or if you can't get it because of health reasons, personal reasons, religious reasons, what have you, it doesn't matter. You just call us and let us know, and we'll make sure you get that $100 credit. If you let us know that you do not smoke, or if you do and complete a quit smoking program, we are going to give you another $100 credit. And lastly, this biometric screening from your doctor, this can be satisfied with your annual physical, that blood work and panel that they do during that annual physical. This can be satisfied for that as well. So you just give us a call, let us know you've had it, and we'll check the claims history and we'll go ahead and give you that credit. The flu shot and the smoking, we are going to take your word for it. Again, we're not going to have you submit receipts. We're not going to have you submit any hair samples, saliva samples, nothing like that. You're gonna let us know, and we're gonna take your word for it. Okay, so that's three very easy credits right there. Now the last two are actually going to be easier than that, because the virtual second opinion program is if you are having a non-urgent or non-emergency scheduled surgery in 2022, you're going to give this number a call, and that's the 888-361-3944. And you're going to see if you need a second opinion, or if we would like you to get a second opinion on that. If it's on that list, they're going to let you know, get a second opinion, and we're going to leave that $100 credit. And when I say we're going to leave it, it's because both of these programs, the virtual second opinion and the condition care, every single person is going to get that credit at the beginning of the year. Because as you may already know, not everyone's going to qualify for these things, right? So we want to make sure that everybody gets it. And if you qualify for the virtual second opinion program or the condition care program, which is if you have asthma, diabetes, COPD, heart failure, or coronary artery vascular disease, we are going to automatically give you these credits. If you qualify for these programs and you opt out of it or say thanks but no thanks, you have that right. It's not a problem, but it's at that time we will take back that credit. Now, another thing that I definitely want to highlight is that if you have a dependent on your plan, no matter how many dependents you have, regardless of age, if you have a child who's 5 years old, child who's 25 years old, you might have an overage dependent who's 45 years old. It does not matter. All of your dependents, regardless of age, will automatically get all 5 credits in January every single year they are on this plan. Again, it is exclusive for PERS Gold. So, we really are trying to make this as easy as possible for you guys to get these credits. We just want you to be engaged, and just kind of be involved a little bit more, and we're going to reward you for doing that. Now with the HMOs are obviously designed to make your healthcare experience a lot more convenient, and the things that you can expect from them have not changed, right? You're going to choose your primary care physician to coordinate your care. You and your eligible family members do not have to enroll in the same medical group. You can choose a pediatrician as a PCP for a child as well, which is always nice. And costs are going to be straightforward. You're going to have low copays when you see the doctor. You're going to have no deductibles to pay. Preventive care is covered at 100%. and you're not going to have claim forms and things like that to fill out. You're just going to be able to make your appointment and go. You are also going to have continuity of care if you're already in treatment. You can continue with your care team, and we will also help you transition to your new plan and providers. Okay, so if that's another concern, we can definitely help you with that. Lastly, another thing that I want to point out with the Anthem HMO plans is that you are covered away from home, not only for urgent, emergency, and follow-up care. We will also get you with a guest membership when you are away from your home for 90 days or more. You do not have to wait until after the 90 days to call or to try to get connected. If you know that, say you have a child that's going to be out of state, if you have a spouse that's going to be out of state, or even yourself, let us know, and we will see if that state participates with the guest membership program, and we will get you connected with a primary care physician and a primary medical group, and that will allow you to have all of your medical benefits where you are, even though you're out of area / out of state. Okay, so that's really going to be a wonderful, wonderful thing for those of you who want to be in an HMO but think you don't have that option because you have someone out of state. This is going to be a really great option for you guys. Again, the HMO plan benefits are identical across the board between all carriers. Your office visits are $15 for office visit, urgent care, and chiropractic and acupuncture. That acupuncture and chiropractic is through the American Specialty Health Network, which we also know as ASH. Emergency care has a $50 copay that is it is waived if you're admitted. And lab tests and x-rays, hospital and outpatient care, and preventive care is at no cost to you. And pharmacy benefits are also included with the HMO plan, and it's also administered by Optima Rx. We do offer 2 HMO plans. We have our traditional, which is available in 36 counties. It is our full HMO list of providers. It does have a higher monthly premium, but you're going to have, more options in more counties for those who may be out of the immediate area. For our select HMO, it is a select network, meaning it's a narrow network, and it is a lower monthly premium, and in some cases it's quite a bit lower, depending on region you might be in. And that is available in 24 counties. So let's take a look at where are you going to be, and what are these networks? What are the networks that are going to be available to you? So this is not an all-inclusive list. This is just a snapshot of some of our key medical groups. So in the northern region, we have Sutter Medical System, which is a huge, huge factor for people up in the northern area. The Bay Area, we have Palo Alto Medical Foundation, John Muir Physician Network, Sutter East Bay, and Brown and Toland Medical Group. And in the southern region, we have Facey Medical and Healthcare Partners. For our select HMO network, in the northern region, we have UC Davis Medical Group, Hill Physicians Medical Group, Sacramento, Mercy Medical, and Woodland Clinic Medical Group. In the Bay Area, we have Santa Clara IPA, Alta Bates, and again, Hill Physicians Medical Group in the East Bay locations. And lastly, we have our southern region where we have Lakeside Medical Group, UC San Diego Medical Group, Rady Children's Hospital, and exclusive for LA and Orange counties, we have our Vividy Network, and we're going to take a look at that right now and what that is. So the Vividy Network is exclusive for our select HMO members who live or work in LA or Orange counties. And it was created through the first partnership of its kind, really. So Anthem Blue Cross partnered with 7 of the top-rated health systems in Southern California in 2014. And we're trying to really give that kind of that whole group experience in LA and Orange County, where normally you would not have access to each of these groups and carriers. You're going to have all of them really available to you. So one network that includes Cedars-Sinai, Huntington Hospital, Memorial Care, PIH Health, Good Samaritan Hospital, Providence, Torrance Memorial, and UCLA Health. Now here is a bigger picture where you can see the different hospitals that are part of our Vividy network. And if you wanted to check out the full list, you can always check out vividyhealth.com, and that's VIVITY health.com/network. Okay. So our Anthem PPO and HMO plans do have an application, so that way you have everything readily available to you on the go, and that's our Sydney Health mobile app. It is included on both HMO and PPO plans, as I mentioned, and it's going to give you that 24/7 access to finding health answers from your smartphone or your device. Okay, so you can use it for checking your copays before you go to the doctor. You can see what the benefits are. You can do a search for your doctors, hospitals, labs, etc. that are in your plan's network. And even more importantly, it's going to house a digital member ID card. So for those of you who are still taking pictures and saving it in your phone, you don't even have to worry about doing that anymore, because it's all going to be right here in one place. Your member ID card and all your benefits and things like that, all included on the Sydney Health mobile app. Care without leaving your home has been absolutely a huge focus in the last year and a half, as you may know. So our Life Health Online Telehealth Video Visit program, it is included in both the PPO and HMO plans. It's an it's a copay of $20 for PERS Platinum, $10 for PERS Gold. Sorry, I missed that part there, PERS Gold, and $15 for both traditional and select HMO plans. Okay, so if you have a common health issue such as flu, allergies, earaches, you can have a video visit anytime with a board-certified doctor in just a few minutes. And you can also have a video visit with a board-certified psychologist or licensed therapist for mental health needs. So being that appointments are available 7 days a week, and a doctor can even send a prescription to your pharmacy if you need it, this is really life-changing, you guys, for a lot of people, because you may have, you may be in an area where you're rural and it takes quite a while to get to the nearest office. You might be in an area that's, congested still with traffic from getting, place to place. And another great thing with this is if you are one who, you still do not want to go down to that emergency room or urgent care, or even your doctor's office for things that are just kind of basic stuff, but it's really your only option, this is going to give you that other option, and you're not going to have to be around other people in a medical situation where they're not feeling well. This is going to be a huge, huge life changer for you. I used it this summer. My daughter had an earache. She's 4 years old. She wasn't feeling well. It was in the evening on a Saturday, and urgent care is closed. Her doctor's office was closed, and her option was really just the emergency room. And the last thing I want to do, even if she was feeling well, is pack a 4-year-old, in the evening when she's past her bedtime, she's not feeling well, and go down to the emergency room, not know what to expect, and how long you're going to be there, right? So we decided to go through our Life Health Online, and my husband was on his way to the pharmacy to pick up that prescription for her eardrops in literally less than 20 minutes. So this is just a really, really great program, you guys. If you're on vacation or whatever, this is a really great thing to utilize. So your HMO and PPO coverage travels with you. With our HMO plans, if you live in another state, again, for 90 days or more, you can set up an away-from-home guest membership. If you travel outside of California or take a trip overseas, you will always have coverage and access to urgent and emergency care no matter where you are in the world, no matter what plan you're on. And if you travel outside of California with your PPOs, you have your full benefits and access to our full network of PPO providers through Blue Card. And our Blue Cross Global Core program is going to give you access to doctors and hospitals in 190 countries and territories around the world. And also, that is going to be for urgent and emergency care, but you are going to have coverage no matter where you are. So with that, Thank you so much, you guys. I'll go ahead and turn it back over, and thank you for listening to 2 presentations combined into one for the PPO and HMO plans that Anthem offers.
Thank you so much. It's very important information. We have some pressing questions for the breakout room. And thank you, Christina, for being great.
I just had the question.
Oh, okay. Okay, Carrie, what's your question? And then I'll take, let's see, Hansel.
I just was wondering if there was any room, I mean, if there was any meeting for people that are just trying to figure out if they're eligible.
Okay, that is, you have to start with your vice president over your division, or with your chairperson, because they will be able to tell you if your assignment load and how long you've worked as an adjunct qualifies you. Okay. Now, if you shoot me an email, I can send you some links that will give you some of the general rules, but you still have to go back to your campus to make sure you meet the FTE assignment load to qualify.
Okay, very good. Thank you.
All right, so you can do that. Thank you.
All right. Thanks.
Bye-bye.
Oh, actually, I have just a quick question, and I wasn't sure. I don't think Wendy was able to answer it. So I'm with LACCD, and as a full-timer, LACCD is going to cover the premium, right?
Well, it depends on your choice. And so it's based on where you live, what kind of plan coverage you're going to get, how many people are going to be on your plan. So I can't tell you yes or no. In the chat box, I also put in the spreadsheet where you could calculate and determine for yourself as well. And I sent it via email 2 days ago.
Oh, yeah. I saw that, and I did it, and I did the calculation, and the number was not in red.
So you're good. So you're covered.
It just seemed so easy, and I just want to make sure I did it right. I mean, I put in the plan, I put in how many dependents, and I put in the number, and then it said, okay, it's not red. So
you're good. You're
okay.
Good.
And so I'm at East Los Angeles College. I live in Redondo. We're Region 3, right?
Yes, we're Region 3.
Okay, I did it correctly then. Thank you.
You're very welcome. Okay.
Can you tell me, for the FSA, does it automatically continue with what you put in last year, or do I have to go back in there and?
Oh, no, you have to go back in. And I sent the video from the presentations that were presented. That video was very thorough, and it tells you how to register. But send me an email. I'll send you a quick and dirty sheet. But every year for FSA, you have to re-enroll.
Okay, so I'll send you an email just for a short, if you can give me the quick steps to re-enroll.
Yes. Okay. I will do that. Yes.
Thank you.
You're so welcome.
Okay, let's start with Karen's question about going to the portal and going through open enrollment in that respect. First and foremost, to get to the portal, I'm in the test portal right now. So again, as I indicated earlier, I have dropped the PDF showing how to get to the portal, which is myportal.laccd.edu. Once you're in the portal, it should start off on the open enrollment screen, but if not, it may start on some other screens. But you'll just click to get to the open enrollment screen. For the most part, the IT department has set up the portal so that when you go into it, myportal.laccd.edu, it starts on the open enrollment page. In order to go through open enrollment, you start your open enrollment. It asks if you want to read the booklet or if you want to continue. If you ask to read the booklet is going to open in the background. So you would start reading from that, and then you have to X out and start over again with start your open enrollment and continue. I think we've resolved this issue. I used to have people calling about the portal not moving forward, and it was because they had a pop-up blocker on. For the most part, I'm not getting those calls this go round, but if you click continue and it doesn't open up, that means there's a pop-up blocker somewhere on that you need to allow the district's to allow the district's website to open up. But as indicated, for the most part, I think we resolved this.
Okay, there are some issues with the different browsers. Some people have indicated to me prior to the room's closing. And so I've advised them to try a different browser. If Firefox is not working, go to Chrome. If Chrome isn't working, use Edge, but try the different browsers and of course, check the pop-up blockers.
And one of the things that I've noticed just from this IT department is that they tended to like Internet Explorer. Now, Internet Explorer is going away, so I don't know if they have a newfound favorite, but for the most part, they tended to like Internet Explorer. What I am currently using is Microsoft Edge, because again, Internet Explorer is going away. So I wouldn't even know how to tell you how to work most browsers now. So this is Internet Explorer. And like Katria said, step 1 is to look for pop-up blockers. And step 2, it might be the type of browser you're doing. Now, one of the things I observed is that most people just print either their current benefits or they say no changes from previous years. So skip steps and preview. If you skip steps and preview, as a reminder, for those of us who are in PERS Choice, like this person is in PERS Choice PPO, that plan is going away. So if you just skip steps, then what you're going to get is a preview of just your dental and your vision. So you cannot skip steps if you're in PERS Choice or PERS Care or Select, because those plans are disappearing. You continue your open enrollment and it gives you this message about 26-year-olds and adding a middle name or something crazy like that. I hate that message. And I've told them I hate that message. Here, you'll have the middle name. I'll push OK. And if you need to add a new dependent, OE workshop, testing again is my dependent's name, 0822 2001, social security number 1, 2, 3, 4, 5, 6, 7, 8, 9, male, child, save. And yes, now what I just did was added dependent demographics. You are not done with open enrollment when you do dependent demographics. Most people, they think that they're done. What happens at this point is you added the demographics. I will do something where I request additional documents. There's a file that I run that says, oh, these are new dependents with new demographics. You need documents for these people. However, if you do not click OK and continue through open enrollment, show plans, whether it's in your home zip or your work zip, and you look, you will see that none of my dependents are enrolled. So if you stopped at that earlier page, even if I request documents, because that earlier page is a locked screen page, if you did not go through and add these dependents, then they won't be on the plan. You see red marks, open enrollment workshop test. I don't pay anything. Let's see. I'm going to go to PERS Platinum and continue, accept the change. Yes, I accept the change. Safeguard, add, continue. Here it's telling me to find a dentist. If I try to find a dentist, it's probably not going to work, but I'm going to click it anyway. It does go to a separate screen where you can find a dentist for Safeguard. For Delta Dental, you do not have to go to that separate screen to find a dentist. Save, and I accept the change, continue. Vision, I am not accepting because I forgot to add the person, continue. I accept now. Then it asks me if I want to go to life insurance. Yes. Here on life insurance, you can do one of two things. You can either add some additional primary dependents. I canceled it. Anyway, don't cancel. You have this beneficiary here at 100%. This is allowing a little more percentage only because it's a test screen, but it should also equal 100% for the contingents. So you have a beneficiary, you have contingents. Continue. It's telling you that you need to submit a beneficiary designation. And if you make any changes, I would like for you to submit the paper beneficiary designation that will open up and ask you for that beneficiary designation.
I can't hear you. Okay.
Sorry. Thank you so much for organizing this. It was very beneficial.
Oh, good.
I was just popping into my portal now.
Uh-huh.
Is this something I can access from home, or do I need to be from my desktop computer?
No, you should be able to access it from now. If you have the district's, what is that thing called? It's the my portal, my LACCD portal is that one. So you should be able to, yeah.
Do you see my screen there?
I do see it.
So when I click here to my portal, let's just go here, right here, right?
Okay, you see SAP?
Oh, did I just miss that? I'm sorry.
Okay, let me see here. Open enrollment, that's the big one. Health benefits, that's it.
This one, right? So when I click this, maybe I need to try a different browser, but nothing.
Yeah, you might need to. Mara, go ahead.
I wanted to do, when she did her presentation, she talked about Vividy. Is that something we enroll in separately?
Vividy? Yeah. So it's not like it's an option. You're either, right? It's whose network you're actually going to. So it's the Vividy Network. If you choose a doctor from that network, you're in that Vividy sub-plan, is the best way I can explain it.
Great, thank you so much.
Okay, you're welcome. Thank you for that. Okay, we still have hands here. I have loaded the certification of, it's called the VDT use, meaning that you are enrolling in the CVC vision care program, which means you work on computers a whole lot and you need an extra pair of glasses for computer work. And so, Karita, has that form been deleted yet or discontinued, or is it still valid?
For the most part, it's been discontinued. If someone just emails me and says, hey, I need to figure out VDTs, there are certain class codes that are not eligible. But if you say, where do I get computer glasses? If you email me, you do not have to do the official form, just email me. And I will automatically put you into computer glasses, and I will try to make it effective so that you can make your appointment same day or next day.
My question was about, I'm an adjunct and I wanted to sign up for dental and wanted to find out what my options are, because I just haven't been able, I'm sure it's simple, but I haven't been able to locate that.
The dental is on the district website. You only have two options: Delta Dental PPO,
Right.
Safeguard HMO. With Delta Dental PPO, regardless of the years of experience, the contribution, the calendar year maximum is $1,000. With Safeguard HMO, you do not have a calendar year max, but you have to consider that with an HMO, you have to have a primary care dentist who recommends any general or any specialty service that you need.
Okay, and how would I find out what's covered on those plans?
It is on the district website. We have an explanation of coverage, and
there was a video that was provided to everyone via district website as well, district email, that covered both of their plans presentations just at the end of September. I will try to locate that and load it in a few minutes.
One last thing, am I correct? And did I see something to the effect that my contribution for one of the plans, the Delta, would be approximately $49 a month versus about half of that for the other plan? Does that sound right?
I was trying to pull up a screen share.
Sure,
For
thanks.
Delta, it all depends on your FTE. Let's see. And it depends on your FTE. So for 2022, we were discussing that each discipline is different. The standard FTE that I'm used to is 33%.
Right, and that would apply to me.
And for Delta Dental, it's $59.70 for one party, or depending on it depends. But the average you'll be paying for Delta PPO is $59.70.
Got it. Per month. Got it. Okay. Thanks for your.
You're welcome. And for the adjuncts out there, just to let you know, what's going on is that we take the actual cost of the plan. Since we cannot do deductions during July and August, we actually have to do some math. The plan cost minus the district contribution. If there is no district contribution, then quite obviously it's zero. Multiplying it over the 6 months of coverage, dividing by the 5 pay periods that we're able to get. And that's what you'll see on your warrant. So that's why instead of $49.75, you saw $59.70 to keep you covered during July and August.
Got it. Cool. Thanks.
You're welcome.
Great. Thank you. This is Mark. I'm also an adjunct, and I've spoke about I had these questions earlier, but I now have the rate sheet that you dropped, and I'm looking at it. And page 6 of that rate sheet, the costs are different than page 9. I'm looking at page 6, which is subscriber plus 2 dependents. And that's a little more expensive than the rates that you have on page 9, which is the 2022 rates. On page 9.
As a reminder, for page 6, it is the flat monthly rate. For page 9, as indicated, because we cannot take deductions during the summer, July and August, we have to do the funky math, the number of months of coverage, which is 6, divided by the 5 pay periods that we can get it from, and then that will always make it a little higher. So
page 6 is actually a little lower than, page 9 is a little lower than page 6. So is page 9.
Which one are you looking at for page 9?
Adjunct 2022 rates.
What particular plan?
We'll just use the first one, the Anthem HMO Select, as a topic, discussion point. That's $15.13.72 and 72 cents. Whereas in page 6, it's $17.58 and 85 cents for a subscriber plus 2 dependents. So is the page 9 for family, when you say family, is that just 1 dependent and not 2?
Okay, the $1758.35 is the actual cost of the plan for a monthly rate. Then if you look over to the right, like you see at the top on the left side under Anthem Select, it's plan cost family. If you go over to the next column, you see adjunct share, Anthem Select 1513.
You're on page 6?
On page 9.
Oh, page 9, yes. Yes, okay.
So the 1513 is the math of it all.
Okay.
So when we go back to page 6, page 6 is not really, hasn't really done any calculations. I haven't done any calculations, but I'm seeing that the 2-party plan is what, $17.58?
Right.
That's just a monthly rate. I haven't even subtracted the district's contribution.
Okay. All right. So I should really pay attention to page 9.
Right. Page 9. Rate. Yeah, that's what you're going to see in your check.
Okay. All right. That answered my question.
Right.
So I have currently PPO choice. So my guess is that if I can enroll on the website, that would be great. But if I get stuck, it's automatically going to shift over to the premium. Is that correct? Platinum.
Platinum, correct.
And I'm retiring at the end of the year. So my understanding is 30 days before my retirement date, I send you an email with my new health information. So that would probably move me over to a supplemental Medicare PPO plan if that was my choice. Am I making sense?
You're making sense. You probably should attend one of the retirement for, you're in CalSTRS, right?
CalPERS.
CalPERS.
He attended last week.
Okay, so
This
there
week,
are
I mean.
certain things that are going to be requested. I think I may have mentioned it, something about a Medicare card and all of those things. But once all of that is submitted, then yeah, you'll automatically go over to your plan and the Medicare portion of your plan. So you full-time or part-time?
Full-time. And
Okay.
my question is, I have had already made glasses for the BDT, computer glasses. And I wonder if that benefit is gonna carry over with the new plans.
Vision plans are separate from medical.
Sure.
So if you've already got your VDTs, done that, you did that separately. It's not affected by the consolidation of any of the medical plans.
And
you'll keep your VDT eligibility. You do not have to submit it yearly.
But if you're retiring, you're no longer an employee and you no longer need the computer glasses offered through the district. So the VDT benefit only is if you're actively employed with LACCD.
Got it. That's perfectly fine and clear, but I'm not retiring yet. So do I need to submit the VDT form for this year's glasses?
No, if you've already got VDTs, you remain eligible.
Perfect. And then one last question before I go, and I know that Katrina has been, it understands my situation. So once I retire, my benefits, Social Security is not going to kick it off right away, but I'm going to have health benefits through the district. Is that correct? Did I get that right?
Yes, just make sure you submit the application. When are you retiring?
I'm not sure yet, but
then don't worry about it. But yes, when it's time,
it's not December for sure.
And when it's time, you'll submit the application for retiree health benefits with us, and you'll do what you need with PERS or STRS, whichever your agency is, and hopefully we have the staff for a smooth transition.
Yeah, I know. You guys are just going insane. Thank you so very much.
You're welcome. The next person.
Are there any other are they going to be myCalPERS seminars, like the group or the individuals? That's with CalPERS. Never mind. I got my answer. Sorry.
All right. No worries.
Oh, I have a question.
Okay.
This is my first time really looking into a PPO. I'm going to stay with my Anthem though, traditional. But what confused me was the premium I know is paid by the district, but the co-insurance and the deductible. And the co-insurance was $2,000.
That's cheap.
That's the co-insurance?
Co-insurance for a PPO? Yeah.
That's real cheap.
Some plans not affiliated with the district, the co-insurance can be between $4,000 and $6,000.
Oh, okay. And the co-insurance kicks in for not for everything, but for some things that you pay for, it goes into almost like a bank account, which I call the co-insurance until that's paid. And then you get 100% free.
No, you're thinking deductible. You're switching deductible and co-insurance up. Okay, so the deductible is what you have to meet. So say, for instance, I had a procedure in January, right? I had not yet, first week of January, I had not yet met the deductible. So when that $500 bill came back, I had to pay out of pocket. Okay. So that HRA FSA card was swiped. Okay. Now, since I've met that deductible, if I have another procedure, do lab work, go into the hospital, go to have various things in an emergency room, my deductible will be applied to those procedures that is applicable to.
Oh.
All right. Anyone else before we start the weekend?
So Katrina?
Yeah.
Sorry to bother you again. So while I am on it, I just completed my enrollment.
Okay.
And then, like at the end, it's asking me to print out and sign and send physical form. Is that what I need to do now?
You saw the email address. I think I may have pointed it out. You would send it to that email address, health benefits.
We all have to do that, Karita?
Yes.
Why?
I do.
Well, let me rephrase that. Those of you who switch plans,
I see.
PERS, whatever it is, premium, gold, platinum, whatever.
PERS platinum and
Karita.
Now I'm hoping that things go well, but hope springs eternal. So
okay,
just in case.
Yes.
Yes.
So I was actually in a PERS choice, so I actually didn't have to do that. But when I open it, like for some reason, like my dependent weren't covered. So just to be sure, I actually did complete the form. So now I have to send it?
Yes, please send it.
Okay, then like what's the email?
I just dropped it into the chat.
Health benefits at email.laccd.
Okay, thank you so much.
You're welcome. I've also presented or attached in there a Excel file that provides you with the tiers of district contribution towards premiums. Now, please be aware, the district always chooses or has for the past several years the highest premium for the whatever region it is. Now, we're Los Angeles and we're region 1. They choose the Northern California region, which is San Francisco and those other places, which are normally higher. This year, they chose the rate for the traditional HMO. And so that spreadsheet will have those rates in it where you can calculate if you will have to pay any of the premium for the platinum plan. So that is in the chat. Now, for those of you who still have not, it takes a while to get through to some of the internet, cyberspace, computer connections. If you didn't get it, just shoot me an email. I'll be happy to attach it and send it to you. But otherwise, once we complete this recording, editing of it, that is, I will make sure that that information is attached along with the link to the YouTube video that you can view all together. Okay, so that's just so that you can get that information. Now, you keep sending emails about how much do I have to pay. Every person's individual case cannot just, I can't tell you you're going to pay this much or you're going to pay that much. Every person has a different tier. Depends on where you live. It depends on where you're going to be living in 2022. So you have to calculate that for yourself. We have provided you with the tool that will help you get to that answer quickly. Now, I will make sure that you get that information. So please just send me an email.